and often less spoken about, and that's dyspareunia. That's pain during sexual intercourse. And this was from the JAMA Insights of May 2022. So let's first go back and see what is the percentage of dyspareunia. One of the things you have to realize is that dyspareunia affects quality of life, it affects libido, it affects relationships, and it also affects self-image. And that's the reason why, even though we don't ask these questions, it's very important to ask questions of whether there is pain during sex. And also, are there any aspects to it and leading causes to it, and also where and when does it occur? And that's why it's important to take a detailed history. Some of this history needs to be taken by specialists who looks at the psychosexual angle and also at abuse. Now, when we look at we think that around 15% of women live with this condition, and that's quite a high number. So let's now look at, in brief, what this document tells us. It's quite a comprehensive document, and that's the reason why I think it's important that we go through it. So I'll put it forward to you. So let's have a look at it. So what are the causes? And the causes could be superficial, and that's at the introitus, and it could be local vulvar disorders, and that again it's on touch, and you can use hormonal topical estrogen or topical precoital supplements, or like lidocaine. And if these persist, then you need to start looking at pelvic floor therapy to a certain extent. You also look at regional pain disorders such as neuralgia, and these to a certain extent would be diagnosing the neural pathways, and for this often taking a pain consultant's opinion is very important. It classically worsens with sitting and relieving positions, and this pain will be persistent without sexual activity. Then you look at skin conditions which are present, such as lichen sclerosis, simplex, and lichen planus. And again, how do you diagnose it? You look at discoloration of the skin, and you look at topical steroids, avoidance of irritants, and often you may need a skin biopsy. You look at infections, again don't forget about it, such as yeast, herpes, and bacterial infections, and this will give you abnormal odor and discharge. Antifungals and antibiotics, and recurrent infections will require specialist review. With vulvar atrophy, and that is what you see generally in menopause, and where you see pale thin mucosa, you require estrogen replacement, and sometimes you require long-standard local estrogen replacement, which may be helpful. Now, why is this important? Because superficial pain causes are different and deep pain causes are different. And deep pain causes tend to be myofascial, and that's to do more with pelvic floor muscles, and that you can find that out by palpation of the pelvic floor. And here it's important to refer them to physical therapists who are trained in this activity, and that can be usually cured. If you start looking at chronic pelvic pain disorders, and the commonest reason is endometriosis, and often you can examine it by manual examination or an MRI or a scan, and this should be dealt by a specialist endometriosis team. Pelvic infection again is one of the commonest causes, and you will see again bilateral adnexal tenderness, but that's not the only reason. Endometriosis can also give you that, and early treatment and sometimes long-standing treatment is important. Again, looking at fibromyalgia and musculoskeletal abnormalities are rarer, but again the causes. Musculoskeletal often has to be looking at a tear in the pelvis. There will be a detailed severe pain and an orthopedic referral. And in fact, you will start seeing it as men and women tend to get more inactive, and sometimes a strain may be causing it. And chronic systemic such as fibromyalgia, and it's difficult to control and often requires psychotherapy counseling. So these are to a large extent wide causes. And why is it important? It's important mainly because 15% of women will come with these complaints. And if you're going to ignore it and are going to miss it, you're going to miss a very important part which affects the relationship, affects their confidence, affects their libido. So next time you take a history, ask for dyspareunia. Check where the dyspareunia lies. And maybe you may be able to help in these cases.